Hey Viva Lifers, it's Dr. Kelly OMD. We're back with another episode of 5 Minutes of Health and Fitness. It is March Madness, and colon cancer screening and prevention month. So we mentioned that colon cancer is cancer of the bowel. And we've talked about what causes colon cancer, what things you can do to decrease your risk of colon cancer, who are at higher risk of colon cancer, as well as when you should be screened. So my prior episodes talk about all of that. Just a quick recap. If you're over the age of 50 or you have risk factors for colon cancer at a younger age, please get your colon screened. And today we're going to talk about ways you can do screening. So there's stool tests, which there's 3 ways to do that. And that can be what we call a guaiac-based test, which is a chemical test. You can do an antibody test, and you can also do a DNA test. And what's wonderful about these 3 tests are you can do them at home. The other option is something called a flex sigmoidoscopy, and that is done by looking at the lower half of your bowels. The other way you can do is a full colonoscopy, which looks at your entire colon from the top of your large bowel to the bottom of your anus or rectum. And there's also something that's called a virtual colonoscopy. So this uses radiographs to look. The other colonoscopy and flex sigmoidoscopy uses a camera to look. So this is an interesting way, a virtual colonoscopy, and you use a CT. And each test has its, advantage or disadvantage, but you use x-rays and computers to produce images of the entire colon, and they're displayed on a computer screen. So you have several different ways of getting your colon screened, whether at home, with a camera, or with a CT. These ways are recommended by your primary care physician and sometimes a GI specialist, so a gastroenterology specialist, and you should definitely get your screening done. So these screenings can be done every year, every 5 years, or every 10 years, and your physician will go over that with you. Next, we have one of my clients said, well, I don't want to work out because of my hair. And we all understand as women that, especially as Black women, that our hair can be a significant deterrent to working out. Number one, I have a wonderful stylist. Actually, I have 2 wonderful stylists. One who helps me with my natural hair curl, and the other one helps me when I want to flatten it out. But these exercises that I'm doing don't sweat your hair out. So for my friends and my people that do not want to sweat their hair out, then I recommend utilizing the Viva Life Health Hub workout series. So all of these exercises that I'm doing, they focus on your upper and lower body as well as your core, and they don't sweat your hair out. So now we're gonna do our 5 minutes of fitness. I'm gonna put my hair up. As you can see, it looks beautiful, it's healthy, and it's healthy because of what? Fruits, vegetables, vitamins, as well as working out. And of course, you have to keep it clean, and you have to get your trims done. So you can talk to your stylist about how often you should do that. So let's go. Alrighty. As you know, I love to work the lower body, so this is going to be a lower body workout mainly. Doing a few exercises, and of course we pretty much start with squats. So let's go. So we're going to do a squat, crunch, squat, leg lift, and these exercises that I'm doing, what you're going to try to do is do them from 30 seconds to 1 minute, and you're going to do a set of 3, okay? You don't have to do the set at the same time because we're going to move through a set, but this is what helps us with our lower body and our ab. Come down to the ground, push up, push up, modified versions of everything I do. So you can go to your knees, push up, push up. When you're going to your knees, you actually want to make sure your chest comes through the floor. Good. Kind of use your knees as a rocker if you can. And if you're not able to, just push the knee back and just come to the floor. This is another one of my favorite moves. It's a rainbow. So, leg out to the side, rainbow, over, touch your elbow. Leg out to the side, rainbow, touch your elbow. Leg out to the side, rainbow, touch your elbow. Leg out to the side. Good. What you're doing is, this is definitely working your gluteus as well as your core when you come here. And here is just working your whole lower body. Very good. Switch to the other side. And you're always going to be stronger on one side than the other. And that's fine. You just work towards balance and equilibrium. Goal is to get a nice rainbow. So you're really using your toe to paint that rainbow. Good. And if the rainbow is too hard to get really wide, then just shorten it. But just make sure you're making rainbows. Last exercise, really a stretch. I don't feel like I stretch enough, so I want to make sure that you guys get your stretches in, okay? So, you can see my toe is up, my leg is out, knee is bent. If you're unable to bend your knee, then you can always do the same stretch on the ground, making sure that your leg is out straight and you're leaning into your knee, okay? I'm actually trying to do a special move here eventually, so I have to do this stretch this way for me. So we talked about colon cancer, and when do you need to get screened? If you have risk factors like a genetic abnormality, Crohn's disease, irritable bowel with significant ulcerations, or you're over the age of 50, then you should talk to your primary care physician about when you should get screened for colon cancer. We talked about the risk factors. How do you reduce those risk factors? Lower your alcohol consumption, stop smoking, chewing, anything with tobacco, okay? Also, increase your fiber. And I know this is going to sound crazy, but if you are not having a regular bowel movement every day, and it's not difficult to have, and it's difficult to have that bowel movement, then you need to increase your fiber. So the way we do that is to eat green leafy vegetables, we eat beans, we eat nuts. If you need to take Metamucil, fine, but I'd rather you do it in the most natural way possible and increase your hydration. The other thing that we need to do is we actually need to get screened. So screenings can be done at home. You can Google a screening, okay? These days you can get anything that you need done. You just Google a colonoscopy screening or colon cancer screening, and you can find how you can get screened either from your home every year, or you can do a flex sigmoidoscopy, or you can do a full colonoscopy, or you can do a virtual colonoscopy. Either way, please talk with your primary care physician or your primary concierge physician to see how you can get screened. If you don't have insurance, there are plenty of opportunities where you can get reduced price in screening. I promise you, it's better to get screened than to have cancer. So I want everybody to have a wonderful day, and don't forget to do what? Live a life. Have a great day. Bye.